Before we go to break, navigating young adulthood can be hard enough. But one Billings woman started her 20s with a cancer diagnosis. Q2's Asia Gore sat down with the young nurse who is sharing her story to motivate other women to get a checkup.
21-year-old Crystal West loves her job helping patients as a certified nurse assistant.
That's a huge part of me. That's what I do. I take care of people, make sure they're comfortable, or do what I can to help them when they're not feeling well.
She began working at Billings Clinic in 2014 at the age of 18 when her mom got sick.
I took it as my responsibility to take care of my mom, make sure everything was going to be okay with her first of all, and then to somehow financially help.
Through her work at the hospital, West met her best friend, Megan Malin, a fellow nurse.
Kind of see her like a little sister I never had.
Given the 10-year age gap, Malin says she's inclined to give West advice. One piece of advice changed West's life forever.
She was 21, and I would normally say 18 would be a good time to start pap smears, so I already felt like she was a little bit past when she should have gone.
It's an uncomfortable thing. Like, who wants to go have that looked at? And I mean, I wasn't sexually active. Like, I had no risk factors that I thought.
But after that first visit with a gynecologist, the news sent her life into a tailspin.
I was trying to figure out any hole in this entire, story that it could be wrong. I was shocked and I didn't want to believe it. And I was trying to figure out, how on earth, what did I do to make this happen?
West was diagnosed with cervical cancer in September. She began radiation treatment, but in February, more bad news. The cancer has spread to her lungs.
As a 21-year-old, who has to go through that? My 20 young and dumb decisions are, oh, I shouldn't have dated that guy, or I shouldn't have drank that much. It could be the difference between living and dying, her 21-year-old decisions.
Life, as these friends knew it, has changed in an unthinkable way. But somehow, just hours after receiving her latest round of chemo, West sits down for this interview with a smile on her face.
I've been drawing a lot from people around me right now, especially Megan and her family and my family. Anywhere I can find new perspectives or advice or anything calming at all, I'm trying to pull from that.
Not every day is easy, but even with stage 4 cancer, West is drawn to her floor at the hospital.
One of the top 2 CNAs we have on the floor, even with her not feeling the best. She's very kind and very caring.
If I walk into a room and a patient saying, I just feel really foggy today. And before I may have been I don't really understand what that means, but I've experienced it now. Or just this feeling that I have this news and I can't change it. And I know that we have patients all the time that get this news or that are going through something that they can't control.
You do it.
Without Malin's advice, West may not be here today. She can't change her diagnosis, but West is sharing her story to give other young women a fighting chance. In Billings, I'm Asia Gore, MTN News.
Thank you, Asia. We're all with you, Crystal. Tomorrow's Community Monday at Hooligans will benefit West to help with her medical bills. She also has a GoFundMe, which you can find by clicking this story on our website at ktvq.com.